Good afternoon. Thank you for joining us. This is the Aging with Pride webinar. We are pleased that you are here with us. Let's wait a couple of moments for our attendees to log on and get settled. And we appreciate all of our guests and panelists here with us today, giving their time. Thank you for joining us. And if you've yet to do so, please check your name display and change it to your name so we know who's joined us. Let's go to the next slide. I am Carol DeAndres. I am the Manager of Stakeholder Engagement for the Master Plan for Aging, MPA, here at the California Department of Aging, or CDA. And I am pleased to be here with you. We have accessibility features for our webinar. Closed captioning is available to you. You have a CC icon at the bottom of your screen, or at least it's at the bottom of my screen. And click on that and you can show your transcript. If you can't find the CC show captions button, try underneath your more, which is those three dots. Sometimes it hides under there. Next slide. We have American Sign Language interpretation. Thank you, Rex. And you will see Bailey shortly. The chat function is enabled for panelists, CDA staff, and our panelist guests to share out meeting resources and information. The Q&A is enabled for questions from attendees, and we'll work to respond to the questions as they come in. Next slide. Today's recording will be posted on our CDA YouTube channel. Also, we will have the slides and the transcript as well as the survey available on our LGBTQIA page. The link is here. And at any time, you can send your comments or questions to our Engage email box at engage, E-N-G-A-G-E, at aging.ca.gov. Next slide. So today's discussion, we'll have an introduction from our director, Susan DeMarois, who will introduce our esteemed panel. We will go over the survey and focus group findings and have a reaction panel, and then we will have closing remarks. So at this point, I'm going to introduce our director, Susan DeMarois. Hello, Susan.
Hi, Carol. Thank you. And good afternoon, everyone. My sincere thanks to all of you who contributed to today's agenda, and a very warm welcome to all who are joining virtually. We have several hundred people with us today. We've been looking forward to today's webinar. At this critical moment in our state and nation's history, we especially embrace time spent with our community partners. We're uplifted by the words and wisdom of champions for equity and equality in the Aging Network. And this afternoon, you'll hear from Californians we all respect and admire. We are proud in this small way to uplift members of the LGBTQIA+ community with today's webinar focused on older adults. Pride Month is a reminder to chart the progress that's been made over decades in California, with giants like Senator Laird and Marcy Edelman, and fierce advocates like Jupiter and Vincent, and other panelists and listeners today. Pride Month is also a time to take stock of where we fall short of fulfilling the vision of a California for all. The Master Plan for Aging's commitment to the LGBTQIA+ community extends far beyond the statewide survey you'll hear about in great detail today. And it's not confined to Pride Month. In partnership with each of you, we look forward to continuously improving programs and services in all parts of our state for all people. I want to acknowledge the vital feedback we've heard about more explicitly including references to LGBTQ older adults and people living with HIV in our draft state plan on aging. Your feedback has been heard, and we're exploring how and where to incorporate your suggestions in our final plan due to the federal government July 1st. It is now my distinct honor to introduce Senator John Laird. Senator Laird represents Senate District 17, which includes Santa Cruz, San Benito, and Monterey counties. His lifelong commitment to community and legislative advocacy for older LGBTQIA plus Californians has been recognized by the Senate President Pro Tem, who created a new Senate Select Committee on older LGBTQIA plus Californians at Senator Laird's behest, and selected Senator Laird to serve as chair of the committee. We are incredibly fortunate in California to have Senator Laird leading on the issues that matter most to the older LGBTQIA plus population, and we're confident he and others in the legislature will translate survey findings to action and results. Please join me in welcoming Senator John Laird.
Well, thank you very much, Susan, Madam Director. I appreciate that introduction, and I appreciate everybody being here on this topic. I didn't have it together enough to have Pride Month behind me here, the way Susan did, but I think that's one of the ways to kick off my comments, which is in Santa Cruz, we had the 50th annual Gay Pride the weekend before last. It's estimated that there were between 9,000 and 10,000 people there. And as somebody that marched in the first ones, many times we had more demonstrators than we had marchers. And it was a difficult time. We weren't really sure how things were going to turn out. And now it is the biggest celebration in Santa Cruz County politically every year. And the key thing that happened, just anecdotally, is I was involved, I think it was in 1978, 79, 80, in a transformational local men's group. It started with 10 men one night a week, and there was a time when it was up to 90. There's still a gay beach volleyball that some of us started out of that group. There were political organizations, there were different cultural organizations, and there was a 45-year reunion of that group as part of the 50th anniversary Pride celebration. And everything that you're going to talk about today was the subject of the informal conversations at that group. There were people there that were long-term HIV survivors living with HIV for decades. There were people there that were struggling with different health issues. At the time that those of us came of age then, it wasn't as common to have children, even which is very much integrated into the LGBTQ community now. And so there are real discussions about how people are caring for themselves as they age in place. What are the challenges if you have to go into skilled nursing? What are the challenges if you end up being essentially alone in having somebody help manage your financial affairs? Just how do you deal with the issues of aging and LGBTQ? And one of the first anecdotes was from somebody that I heard in the past, not at this, but it was repeated, that people would go into skilled nursing and feel like they had to go back in the closet because they felt vulnerable in that setting. And so what do we do in services for Californians that sort of address these real needs that are happening on the ground? And when I first got back to the Senate in 2021, I authored Senate Bill 258, which added HIV status as a category of special significance in delivering services by the Department of Aging and Aging Services in California. Because when I ran an AIDS service agency in the 1990s, we had the challenge of just never dreaming anybody would live to old age. Now 50% of the people with HIV in California are over the age of 50, and we have to make sure they're integrated into service delivery. So the survey that was done under the auspices of the Department of Aging is really important. Some of the things that come out of it are not a surprise, but at least they are clearly documented. At least they have been provided with some evidence as to why we should consider those in public policy and what to do. And so I know we will be having an oversight hearing at some point of the select committee that Susan mentioned to go over what is in the study, to invite people to the table to talk about it, and to identify what are appropriate policy directions to make sure that our services are addressing the needs of LGBTQ Californians. So that's why I'm excited that there's the webinar today. I'm sorry I have to go off to a Senate floor session in a few minutes because I would love to stay with you during the afternoon. And I know that I will have people there that will report to me on what was said. But it is really mobilizing the experience that exists on this webinar, mobilizing people that are working in the trenches to make sure that they reflect what they're seeing so that we're not missing anything, and also to make sure that you advocate. I was at, we're so successful these days in some ways. I was at Gay Pride in Atascadero this weekend. And in the course of it, I was talking to somebody and explaining that when I was in the assembly and we did marriage equality, my male ran against marriage equality for a while, even though I knew my constituents were strongly in support of it. And it's because they knew I was there and they didn't think they had to write me. So I was only hearing from people that disagreed. So my last message is don't assume everybody knows. Don't assume everybody agrees. Don't assume because there are people that you're going to hear on this webinar that are unbelievably articulate about the services for LGBTQ Californians, that they don't need to be supported, that we don't need to organize people across the state to speak up and support these efforts. So I want to thank the department for doing the survey. I want to thank everybody that worked on this webinar. I want to thank all of you that are about to participate. And I look forward to working together to just make sure we meet the needs that are outlined in this survey and that we identify as citizens of California. So thanks for having me today. And I wish you luck in a successful event.
Thank you so much, Senator, for joining us and leading us off today. And we know this is a very busy time for you, and you are needed on the floor for all of us. So you are absolutely excused, and you are an impetus for this survey, and the work will continue. And we really are excited about your leadership of the Select Committee.
Thank you very much.
Have a good day.
Okay, take care, everybody.
I'm now pleased to introduce our next two speakers. As some of you know, the Master Plan for Aging is a public-private partnership, and I am pleased to welcome one of our academic and nonprofit partners, our academic and nonprofit partners in this work, instrumental to the survey that you'll be learning about today. Angie Perrone. Dr. Angie Perrone is the director of the Center for Advanced Study of Aging at the UC Berkeley School of Social Work. And Dr. Kathleen Sullivan started as executive director of Open House and was instrumental to getting the survey off the ground, and now serves as a consultant and is still very much a part of this work. Welcome, Angie and Kathleen.
Thank you, Susan. And I think I'm actually going to start. So if whoever it is that's advancing the slide, there we go. So I'm going to speak. You can go to the next slide for just the first 10 minutes or so. And then we're going to give the rest of the time to Angie because she is providing information that has not really been released very widely before on the focus groups that she's done based on the findings of the survey. We felt that it was very important to learn about the aging experience of LGBTQIA older adults in California, and we had over 4,000 respondents from every region of the state of California. So this is just baseline data And it does really mesh very well with the goal 3 of the Master Plan on Aging, which is inclusion, not isolation. You can go to the next slide. Thank you. And these were the partners that were involved. Obviously, the great leadership from Susan and her staff at the California Department of Aging. Ross was the day-to-day partner, so thank you so much, Ross. And then Citrus, the Bonanno Institute at UC Berkeley, and Open House. We were sort of the 3 first partners, and then expanded and hired UCSF School of Nursing to do this study, and then of course brought in the Center for Center for Advanced Study of Aging Services with Angie Perrin, who you'll hear from a little bit later. You can go to the next slide. Thank you. So we wanted to start by grounding this research in the community. And the way we did that was we crafted an advisory committee. And that advisory committee, you'll actually hear from Vince a little later because he was one of our advisors, really worked with the researchers and had the opportunity to give feedback on every single question that was in the survey. We also, through the great work of Jupiter Peraza, were able to build a statewide coalition. So we looked at regions. California is very large, so we did have regional groups, but also a statewide coalition, which is ongoing. It's an evergreen coalition. And that was really one, to get, again, more feedback about the survey, but then also to ensure that once we were done crafting the survey, we had trusted partners, trusted voices out in the field who could help get the survey into the hands of people that were going to be taking it. You can do the next slide. Thank you. And some of the findings, we had, like I said, over 4,000 respondents from every census district in the state of California. We had great representation from people 70 and older. So I was personally, as a gerontologist, very happy to see that. And I would say geography probably did better than we initially thought we were going to do. This survey was only in the field December, January, and February. So it was a truncated period of time out in the field. And then we also didn't have a lot of time. Jupiter will talk about her wonderful work, but we didn't actually have an enormous amount of time to build these coalitions. So if you can go to the next slide, we also certainly had a challenge in terms of representation of all the diversity of California. So that's one thing for the future. If we are to look in 5 years or so to go on and look at other opportunities for reaching out to the LGBTQIA community 50 plus, that we'll be able to include more, for instance, Latinx community members, more African American community members. We saw in the study that was done in Oregon, they had a 3-year period to actually build their coalition. So they were able to get deeper support and deeper participation from a wide variety of communities. So what did we find? You can go to the next slide. We're just going to highlight a few things that we found. One is that there is just continually unmet service needs. And part of that is the traumatic experiences that people have had in the past. So people experiencing trauma, particularly with providers of care, oftentimes do not trust those providers and do not go to those providers of care. So it's not surprising that transgender women have the highest level of lifetime experience. As Senator Laird was just saying, a lot of people in our community kind of knew this, but we only knew it anecdotally. And so the incredible benefit of this study is that now we actually have the data. You can go to the next slide. And go to the next slide as well. Thanks. So we also looked at financial challenges, and this is a particular concern, particularly when we think about housing in the state of California. We found really mirror images of what the economic insecurity and food insecurity was for our community members throughout the state of California, whether they were living in an urban area, a rural area, or even a frontier area. You can go to the next slide. Thank you. We also know that LGBTQ older adults had a heightened level of reported feelings of isolation. So, California, if you go on the wonderful California Department of Aging website, you can actually see the latest survey that was done that really showed the level of isolation that older adults are reporting in the state of California. And that number is at the top, 40%. And overall, LGBTQIA older adults have a slightly higher level of reported feelings of isolation based on the survey that we did. If you look all the way at the bottom, though, and I think the thing for me that really sends up a warning sign is that transgender older adults report 62% having feelings of isolation. And we know, based on the wonderful research that's been done at UCSF, that feelings of isolation and loneliness correlate with early onset of death. And so we want to make sure that we're creating opportunities for people to actually come together with their community. I'll also just note that Asian LGBTQIA older adults have similar levels or higher levels of isolation. And I think Angie might be talking about the challenges of actually getting a focus group of Asian LGBTQIA older adults to participate in her study. You can go to the next slide. Thanks. Lifetime experience of mistrust with authorities. And this is unfair, disrespectful, or discrimination that people had experienced in the previous year. So they took the survey in November or December. We asked them just to think back 1 year. And you can see that there are really quite a number of people that are having high levels of mistreatment, unfair treatment. Not surprising again, people of color and transgender women are experiencing very high levels of discrimination or unfair treatment. And this is, we were just down doing a presentation in San Diego. I think it's surprising to some people to see these numbers in the state of California, which we really think of our state as being very welcoming and very embracing of the LGBTQIA population. You can go to the next slide. So what are signs of resiliency? You know, this was a study that didn't just look at, all the doom and gloom, but how does this community actually, how do they uplift themselves? Are they resilient? And how can we actually show that? And if you looked at the quality of life data, it was really quite interesting that when you look at people who said their life is excellent or very good, when you add good to the equation, we're actually over 80% in terms of quality of life and over 60% in terms of satisfaction with our relationships. So we're constantly building community. We're looking for opportunities to connect. And I think that is actually a strength of the community and something that we can really build on for the future. You can go to the next slide. So I'm sorry I've gone so quickly, but we have really wonderful data from Angie. I want to talk just very briefly about some of the opportunities we had for action. One was around mental health and cognitive health is really to ensure that we have trauma-informed care and suicide prevention that's really tailored to LGBTQIA older adults. You can go to the next slide. Expanding resources that promote economic security, particularly ensuring that the Master Plan on Aging is looking for local solutions for friendly housing options for LGBTQIA older adults. That it's not necessarily building a site specifically for the community, but ensuring that the affordable housing is going to be welcoming to this community. The next slide, please. One thing that Senator Laird talked about was ensuring that we support organizations that are right now currently providing support for LGBTQIA older adults. So an example, of course, in San Francisco is Open House that was founded by Dr. Marcy Edelman, who will be speaking a little later, but the Los Angeles LGBT Center. There are many places, as a matter of fact, over 53 centers for LGBTQIA community members throughout the state of California, and ensuring that we're putting some type of resources into those organizations because they're the ones who are providing the care now. Next slide, please. And this should be my last slide, and that is really looking for action around discrimination and safety. We were particularly looking at training services that are provided for healthcare workers, mental health workers, but also for first responders. And I know in the Central Valley, there's been some very good very good trainings done with first responders. But also, I'll just say that the California Department of Aging has really put an investment into creating trainings for people who work with older adults, so aging professionals. And you can find those trainings or access to those trainings, and that might be something that Jupiter would talk about later. The other thing is also to ensure that or support having mental health supports and social support groups that can help LGBTQIA older adults relieve stigma, discrimination, but also that really help them to start creating social networks and social bonds. And with that, I'm going to pass it over to my colleague, Angie Perrone, and thank Bailey very much for all of the translation.
Wonderful. Thank you so much, Kathleen. And thank you to all who made this webinar possible and who have done all the work behind the scenes that we don't see, but are clearly integral to making this happen. So I'm Angie Perrone, and I'm going to talk about the focus group part of this study, which is meant to complement and to really dive deeper into some of the nuances and really hear some of the voices from the folks that we're talking about, LGBTQIA plus older adults. Next slide, please. So just as background, the Berkeley Center for the Advanced Study in Aging Services, we focus on research, education, and policy to really explore the broader environmental, cultural, and social drivers that have the greatest impact on aging and aging services. Next slide. And then you heard all of the amazing work that came out of the survey. And so the focus groups aimed to build off the survey, and we conducted focus groups in mid to late 2024. So we started a few months after the survey closed, and we were really targeting underrepresented LGBTQIA plus older adults who tend to be the hardest to reach and often excluded from research services and policy, including folks who have low incomes, folks who are minoritized, and geographically isolated. Next slide, please. And we also, building off of the coalition and the other work that the survey did in terms of building community, we were able to make connections and relationships with 18 formal community partners. And so these are some of the partners, or these are all the partners that we worked with in terms of helping us recruit folks, helping us coordinate focus groups, and helping us make this part of the project possible. Next slide, please. And then it's important to thank the three funders who also made this possible: the California Healthcare Foundation, the SCAN Foundation, and MetaFund. Next slide, please. So we had four main purposes or aims for the focus group. We wanted to elevate the voices of hard to reach and often underserved communities within LGBTQ plus aging, gather in-depth knowledge about challenges, needs, and supports, what's working, what's not, what do folks want to see, illuminate both creative, surviving, and thriving strategies that could be incorporated into social services, healthcare, and other supports, and then identify recommendations for policies, funding, programs, and services. Next slide. So we conducted 23 focus groups across 16 counties in California with 208 participants. 65% identified as Black, Indigenous, persons of color. I will say that there's an asterisk here because we only had 3% of that number were identified as Asian, API, Asian or Pacific Islander. So that's a community we're still working to reach and build community relationships with, so that we can conduct a couple of additional focus groups with populations there. We had 19% of our sample identified as transgender or gender expansive. 30% had received SSI in the past 12 months due to a disability. 34% are persons living with HIV, and most were long-term survivors. And we included folks who were 45 and 90. We originally had wanted to include just 50 and above, but as Kathleen had pointed out in other research and also conversations with community partners, because of wear and tear on discrimination and trauma, people age differently. The body ages differently in different communities, so we dropped the age to 45. And that was particularly important when we worked with or talked with our transgender Latina immigrants in particular. But the median age was 64. And then over 40% had annual incomes less than $20,000. Nearly 80% were at or below the California individual median income. Next slide, please. So we focused on 9 core communities. And of course, there's many intersections among them. Older lesbians, HIV long-term survivors, folks in rural communities, 75 and over and older, folks who identify as BIPOC, so that's Black, Indigenous, or persons of color. We had separate focus groups with folks who identify as Black, same-gender loving, folks who identify as transgender Latina immigrants, and also Indigenous. And I'll just add, of course, there's intersections among these. And so folks self-selected into these particular groups, and that's how we kind of coordinated. But we used an intersectionality framework to organize these. Next slide, please. And we had 3 main questions that we wanted to get at. What challenges are folks facing? What supports are helping? What supports are working? And then how can policies, programs, and services better serve the communities we're talking with? Next slide, please. I realize I didn't send a link to the video. Is it still possible to show the video?
Angie, if you send me the link, potentially. I don't have the link to the video. This is Ross Lalian from CDA.
Okay.
Thank you.
Okay, I will work on that. And then if for whatever reason you don't get to see the video, we have 7 amazing videos, very powerful videos from community members. And they will be up on our website very shortly. So I can also make sure that folks have at the end, I'll put a link to the website so folks can see that there as well. But the videos really talk about those 3 questions and from folks' own voices. Next slide, please. So the next few slides are really kind of some of the highlights or some of the key points from those 9 core communities: challenges, strengths, and suggestions. And again, we can share these. These are available for folks. This is all meant to be publicly available. And so these are just some of the data. And for the sake of time, I'm only sharing a small amount. But we have a lot of slides with a lot of data. And we also have a whole set of appendix slides with even more data. And we have a 9-part handout series. And so if anyone's interested in seeing these quotes or seeing more of the quotes or seeing more of the data, you can go to our website, and I'll have the link in the chat, or you can email me specifically and we can give you all of that. So I'll start off with our HIV positive long-term survivors, and these are challenges and supports. And so here folks talked a lot more about invisibility and the concerns about a lack of understanding in a variety of different communities. And so I have a quote here where I'm trying to think, unfortunately, I don't think I'm gonna be able to read all the quotes, so I'll sort of paraphrase them, and you can read them if you want to read them while I'm talking. But essentially here, one of the participants talked about the challenge in being told that the physical challenges he was experiencing were related to aging and not the actual impacts of living with HIV and medications from years of taking. Strengths: resilience, adaptability, leadership, and advocacy. So I'll read a few of the quotes. Here, one of the participants said, "It's showing the world that I'm resilient, I'm still here, I'm thriving, I'm healthy. I have a doctor who supports me 150%, and that makes a huge difference. So having supportive providers is critical." And so for suggestions, folks from the folks that we talked to in this community talked about the importance of connectivity, community engagement, and outreach in particular to isolated individuals. And of course, culturally responsive services that acknowledge the long-term impact of HIV. Okay, next slide, please. And here we talked to a number of older lesbians who talked about challenges relating to isolation, limited family support, and physical separation, and especially fears of aging alone. And so here someone says that being an older adult lesbian living alone, it's lonely, and you don't have someone to come home and talk about your day or give support when things aren't good. In strengths, folks talked a lot about independence, community building, resilience, supporting others, and advocacy. So I will read this quote too. Someone mentioned that they said, "During the AIDS epidemic, we had a crisis. There was a stated need. Nobody was going to come and save anybody, so we did it ourselves. I think it speaks to the strength of women in the community. What we need to establish now is that we're in a freaking crisis." So that underscores both the strengths of prior, community building, and also the need to continue to build on those strengths to move forward in the current climate and the current challenges. Suggestions, acknowledging lesbians' unique strengths and needs, and also facilitating networks of support. Next slide, please. We talked to a number of folks in rural communities, and here, not surprisingly, a lot of participants mentioned financial constraints, limited service accessibility, restricted social networks, creating challenges for folks living in many rural communities. And also just finding culturally responsive providers within a network that already had limited providers available. In terms of strengths, folks talked a lot about strong community ties, the importance of active engagement and connection, and having vital resources and services. And so here someone mentioned they say we belong to the Unitarian Universalist Fellowship. People there have become our very best friends. You feel comfortable. It's more than just socializing. It's about healthcare and resources too. So finding other spaces where you maybe didn't have an LGBTQ plus center, but finding spaces with allies and also welcoming spaces that could provide that sense of social connection and support. And then so for suggestions, it was really focused around establishing both a centralized space, but also mobile resource hubs to get, whether it's healthcare support, culturally responsive information about health needs, social connection, and a variety of other things, sharing information, and then building on the strengths of rural communities where LGBTQIA plus aging communities may be open to diverse support groups due to sheer lack of numbers. And so a lot of folks talked about how it was really special to have support groups that had a variety of folks from different genders and races and all sorts of communities coming together because they're in rural communities and they needed, vital communities that to come together with just smaller numbers of folks. Next slide, please. Challenges and supports for folks who are 75 and over. Here, folks talked a lot more about ageism and invisibility that were compounded by declining health and grief from losing peers. So here someone said, the hardest thing about being my age is being my age. I have things I can't do anymore, things I can't do well, and most of my friends have died. And I'll add to important context with the person who made this comment was also a long-term HIV long-term survivor, and had mentioned, I can only fit so much of the quotes on these slides, but had also mentioned how he had lost a large network of folks. He and his friends had lost large networks of people during the AIDS epidemic. And so, feeling these renewed senses of grief as he's aging was really important and important for providers to know about as well. And then in terms of strengths, folks talked a lot about resilience, adaptability, and accumulated knowledge. And that allowed folks who are 75 and over to really mentor younger generations and actively engage in community building. So here someone said, I'm in a good community. I'm grateful for that. I think back to the early 80s when something like this would never have taken place. It's a sign of hope for the future. So suggestions here, most of the groups, actually, a lot of folks talked about the importance of intergenerational connection and programs and supports. But in this group in particular, it really was underscored by a number of individuals or a number of folks in the focus groups really wanting to have more intergenerational dialogues to build community, but also to combat invisibility and to challenge stigma on aging. And so also to incorporate historical knowledge about LGBTQIA plus aging into programs and services. So for example, information and knowledge and history about the AIDS epidemic and the impact of being estranged from families of origin. While that still happens, of course, the degree is obviously different now than it was 50 years ago. And also creative community building and activism. Next slide, please. And here we had a number of challenges, strengths, and suggestions from folks who identified as BIPOC. Again, that's Black, Indigenous persons or persons of color. And so for challenges here, community members talked a lot about limited aging discussions and discrimination, economic divides, physical barriers, and difficulty accessing technology. So here someone says, how do I, as an older Black lesbian, think about entering the world with other people after being socially isolated? What kind of group does that look like, and where is it offered? Can I feel okay about being truthful? Strengths, people talked about community resources, resilience, their passion for justice, self-advocacy, mental health services, creative expression, and spirituality. So spirituality came out a little bit more among our BIPOC and Black same gender loving focus groups in particular. Here, a number of folks talked about the importance of art. And so that came out in the suggestions as both arts-based programming and digital and tech literacy. Next slide, please. And then we had several focus groups specific with Black same gender loving older adults. And here, community members talked a lot more about health, the challenges of health, feeling isolated, again, discrimination, economic hardships, and political uncertainty heightened these concerns. And then strengths, folks talked a lot about the importance of chosen family, and that came out in all of the focus groups, but again, was a little bit more underscored here. Faith and therapy, and in particular, supports with Black therapists, or having representation, physical representation. And then suggestions here, folks talked a lot about creating targeted resources with clear language about accessing services, incorporating more Black voices in decision-making, and supporting co-housing with legal support. So here someone says, co-housing is really great in principle, and they talked a lot about how that's been useful, especially because you're sharing the resources and responsibilities, but it requires stuff to work out. So just having some additional support to make that possible, one-on-one, it's really hard, but having some infrastructure would be really helpful. Next slide, please. And then we had several focus groups focused on transgender older adults. And here, community members talked a lot more about financial instability and discrimination. And so here someone mentioned that the health system for trans women is important. We sometimes face issues like STIs, COVID-19, or the need for critical surgeries. Where can we as trans women go for all of these needs? A friend told me that she went to the hospital using a female name, but because of her appearance, she was told, no, you are a man, and we cannot treat you as a woman. And so strengths were affirming relationships and community support, offering opportunities for spiritual growth and authenticity. Community was really important here as well. And then in terms of suggestions, folks talked a lot about funding for culturally responsive services, including and programs, including affordable housing and culturally responsive affordable housing. And then programs and services that support social connection and community. Next slide, please. And we had several focus groups specifically with older transgender Latina immigrants. And here, in addition to what was mentioned in the previous focus groups, the previous slide with transgender older adults here, there was an added layer of challenges relating to immigration status, workplace discrimination, and ongoing hostility that folks had sought to escape from their countries of origin. Several were still also engaging in sex work or survival sex, and so talked about the challenges of that as they're aging and intersections there as well. And then in terms of strengths, community groups was critical, absolutely critical. That just really was underscored multiple times by the participants here, is having community support. And this was really a lot of informal word of mouth support and much less, I think, visible, overt, obvious support, but the importance of having that. And then also the desire to have more support in Spanish and programs in Spanish. And suggestions, specialized housing with streamlined and culturally responsive services, including mental health and legal assistance, and then education for both agency staff as well as community members. Next slide, please. And then I will say we had the privilege of working closely with Bates, who shared data from their elder talking circles. And so we combined that with our own data, and this slide represents information from both sets of data. And so, and Bates is Bay Area American Two-Spirit Organization. And so here folks talked about challenges related to social isolation, disconnection, displacement, fragmentation, strengths being survivorship mindsets, being in tight-knit communities, mentorship, leveraging lived experiences. And here people talked about, one person said, my community is resilient, many of us are survivors. And so suggestions here were more community spaces for Two-Spirit, Native American, Indigenous older adults. Again, affordable and accessible housing, culturally relevant health education, and again, the culturally responsive piece was underscored heavily here throughout all of these. Next slide, please. So every time I forgive this, I have like new key takeaways because there's so many takeaways here. So here are the 4 key takeaways right now that are, I think, really important for these findings. So 1, LGBTQIA plus communities are diverse and have diverse needs. And so that's part of what this gets at with having these 9 communities. We could have had 10, 12, 14. But the point is while there are some similarities, it's obviously not a homogenous group. And we got that from both the survey, but also that was really driven home by the focus groups as well. 2, intersections of discrimination across one's lives require targeted programs, services, and policies around disability, caregiving, social connection, mental health, and housing. 3, social connection. And, Kathleen talked about the importance of isolation and the impacts, the negative impacts that has on the body. So the desire for social connection is strong, including intergenerationally. And so folks wanted to feel visible, and that looked different among different communities and at different moments in the political climate. And then 4th, targeted services, programs, and policies should build on the strengths, including community, historical knowledge, mentorship, and resilience. Next slide. That's it. So please connect with me. I will put, this is my website or my email, aperone@berkeley.edu. And then we have a general email here, cassis.aging@berkeley.edu. I will put the website for our organization or our center in the chat. We will have all of these materials, the handout series, this amazing 7-part video series, the PowerPoint slides, and a few other things that are all they're accessible on the website. And so we'll have those available. We're in the final stages of website approval, so they should be available hopefully before the end of June. So we're hoping that they're available next week. But feel free to reach out if you want them earlier, and I can send some of them to you as well. Again, thank you very much. I appreciate being invited and being able to share this with everyone.
I think I'm up next, yeah?
Yeah,
Okay.
Marcy, sorry, but yes, thank you, Marcy.
Okay. Well, all I have to say is, wow. So thank you, Kathleen and Angie, for your great presentations. And I have to say it's been an honor and a privilege to have worked with all of you who helped initiate this survey and then to serve as senior advisor for the survey. And this survey really is a game changer. The results of this survey and the work of Senator Laird's special committee will ensure that California's LGBTQ older adults are included in the Master Plan for Aging. And by inclusion in the MPA, we can expect new policies and new programs that improve the health and well-being of all LGBTQIA older adults in California. So a huge, huge thank you to everyone involved in making this survey happen. So I will be moderating the panel discussion, but before we start, I have one quick thing to say. This groundbreaking survey would not have been successful without the guidance and assistance provided by the statewide LGBTQIA Social Service Coalition that Kathleen identified in her presentation. The coalition grounded the research study in the lived experience and critical needs of LGBTQIA older adults and provided community guidance that reflected the broad diversity of California's aging LGBTQIA population. However, the coalition that informed the survey will be ending in a few weeks, and I would like to suggest that the racial and gender and geographically diverse statewide aging coalition be continued to further its invaluable work providing ongoing guidance and research assistance for policy solutions. Continuing the work of the LGBTQIA Aging Coalition would ensure more inclusive research and smarter, more effective policies based on the changing needs of California's diverse aging population. Okay, with that, let's start the panel discussion. So first, let me introduce our 3 distinguished panelists, after which I will ask each one a question, and then some questions from the audience as time permits. Okay, let's get started. So I'd like to introduce Molly Davies, President and CEO of Wise Healthy Aging, a community-based nonprofit organization in Santa Monica. She is a longtime leader in advancing the dignity and quality of life of older adults and has worked successfully to create many innovative services for Southern California's older adult population. Welcome, Molly. Next, we have Vincent Cristomo, who is a member of the Equity Advisory Committee on Aging and Disability and Director of the Aging Services at San Francisco AIDS Foundation. Vince's strong leadership in the API queer community in HIV/AIDS work dates back to 1984. I have had the privilege myself of serving with Vince on a number of city councils. So good to have you here today, Vince. Welcome.
Thank you.
And Jupiter Peraza is the manager of statewide coalition at Open House. I have had the opportunity to get to know and admire Jupiter while working on the survey. In 2021, she was a feminist policy fellow with the Women's Foundation of California. She is a thought leader on a variety of issues from trans civil rights and immigrant advocacy, and in 2023 was appointed to the San Francisco Trans Advisory Committee. Welcome, Jupiter.
Thank you so much, Marcy.
Great. Okay, Molly, let's start with you. Molly, the study focused on community dwelling LGBTQIA older adults. Given that we were not able to research the experience of LGBTQIA residents of assisted living and skilled nursing facilities, we would like you to bring your perspective on the issues facing LGBTQIA older adults who live in congregate settings like these. Can you provide some background on what the law provides to protect LGBTQI residents' rights? And are there any recent issues that have emerged? And what further can be done to address issues such as discrimination, bias, and social isolation?
Absolutely. And I first want to just thank you so much. Thank you to Susan DeMarois and the team at CDA for asking me to join, and with that, ensuring that individuals who live in long-term care facilities are part of the conversation, because people living in these facilities are often isolated and hidden from our communities, the larger community, and that makes them more vulnerable to poor treatment. And if you add the LGBTQIA plus community, that compounds the isolation and hiddenness. And so thank you so much for inviting me. It is not uncommon for LGBTQIA plus individuals to return to the closet when they move into long-term care. And when we talk about long-term care, we're talking about skilled nursing and assisted living and board and care facilities. A lot of times it's out of fear for being mistreated, not only by their peers, so the other folks that are living in these facilities, but also by the staff. And although we've seen some improvement in facilities in terms of their attitudes and treatment, it's not consistent, and there's so much room for improvement. LGBTQIA plus folks should not have to live in fear when they move into a facility that's there to take care of them. You're already in a very vulnerable position because people need assistance with bathing and toileting and have to be vulnerable, but then to also have to not live as who they are in the last years of their life is absolutely infuriating. Not only should they not have to hide who they are out of their fear for their physical safety, but also for their psychological safety. And that's something that we're very concerned about. Additionally, the trans community is at particular risk. And I think that was also evident in the survey, because when they move into a facility, a variety of issues come up. It's sometimes harder to hide. And one issue that comes up frequently is, what room do we live in? The person who is a trans woman, some would like to live in a female room. And then you have the facility that might be pushing back and saying, no, you're not a biological female, so you have to live in a male room. That's completely unacceptable. It's something that we cannot tolerate. We have other facilities that we've seen absolutely embrace the trans community. And that's been a really nice thing to see. So in the work that we do at Wise and Healthy Aging, we're advocates for folks who live in skilled nursing and assisted living facilities. And so over the years, we've seen the changes in acceptance, which have been really, really positive. But again, more work to be done. We've also noticed that in facilities that employ individuals from the LGBTQIA plus community, we're seeing them being more welcoming in general of the community. And we've seen this increase probably the most in the last 10 years or so. I just want to mention another issue that comes up related to Medi-Cal paperwork or healthcare paperwork, which will often have the person's given name or their birth name and not their chosen name. So then we're trying to navigate the facility, ensuring that the person gets the care and treatment that they need, and also using the person's chosen name. And you can get that paperwork changed, but it can be kind of complicated and hard to do. And we've had some clients who haven't wanted to go through that process. So it's just one of the things that comes up. In terms of protections, California has the Long-Term Care Residents Bill of Rights that's specifically for the LGBTQIA plus community. It's there to prohibit facilities from discriminating against folks based on their sexual orientation, gender identity, gender expression, and HIV status. It also guarantees that residents have the right to use their preferred pronouns and their name of choice. And it protects residents from being denied admission or transfer or discharge based on their LGBTQIA status, and ensures that they have the right to privacy during physical examinations and treatment. So this Bill of Rights needs to be posted in each facility. And although there is an ongoing case, so it's being heard before the California Supreme Court because the industry is challenging the pronouns provision within that bill, although the bill is in place. I think the other part of your question was related to what can be done. And on an individual basis, if you know someone who is being discriminated against, reach out to the Long-Term Care Ombudsman Program to better understand your rights and to get assistance in asserting those rights. And I can put the phone number in the chat so you can have access to that. And also, you can also contact your ombudsman. So if you're looking for a facility, they often know a lot about different facilities, and they know which ones are more welcoming to the LGBTQIA community and can help steer you in that direction. And the other thing is, visit your friends, family, and loved ones. You get better care. You get better care if you have somebody looking out for you. And that is incredibly, incredibly important.
Oh, well, thank you, Molly. Molly, I have a question myself before we open it up to the audience. Is it mandated that this Bill of Rights be posted?
Yes.
Uh-huh.
Yep. The Bill of Rights is supposed to be posted in each skilled nursing and what are called residential care facilities for the elderly, so assisted living or board and care facilities.
So that's good to know.
Yeah.
And if people don't see it, they can ask
That's
that,
right.
that it be posted.
That's right.
Okay. So thank you for that, Molly. Any questions from the audience?
I do think there was an earlier question in the chat about specifically about the about HIV designated beds no longer being available at Rio Hondo. That was one part of the question. And I just want to put it out there that if somebody needs skilled nursing, you don't have to be in an HIV. Every bed's an HIV designated bed, right? So there shouldn't be discrimination based on the person's diagnosis, although we know it sometimes happens. So that's one part of the question. And I think the other one was related to finding not having access to like caregiving at home. It sounded like it was about that as well. And I know that there are, depending on the situation, there are like in-home supportive services and those sort of caregiving available, but I know that doesn't help everybody, right? So I would definitely recommend reaching out to your area agency on aging in your community to learn more about the services available there in-home.
Thank you, Molly. That was very helpful. Any other questions before we move on?
Marcy, there's
Okay.
one in chat that's asking if there's a mandate that managers of SNFs must also receive additional training. I think that's for Molly.
Oh, yes. Go ahead, Molly.
So it is not mandated that SNFs have specific training on like cultural sensitivity training related to the LGBTQIA community. That's not a requirement. That was actually going to be in my recommendations in the advocacy section a little bit later, is that's something that would be, I think, very important. Additionally, there are the requirements for person-centered care training and training related to trauma-informed care. So we'll talk a little bit more about that, but specifically to cultural sensitivity for this community, it's not a required training.
Yeah. Any other questions? Okay, thank you again, Molly. Much appreciated. So my next question is for Vince. Vince, hi there. Your
Hi,
life
Marcy.
spans your life spans multiple areas of LGBTQ plus history. How has the experience of aging as a queer person evolved over time, and where do you see the biggest challenges today?
Well, as many people are probably aware, the current administration is trying to roll back histories, and we've made so much progress. And, one of the things that I think hasn't changed so much is the feeling of safety that our people feel when they are put, and it's great that we had the LGBTQI plus Bill of Rights, but you also have to feel safe enough to be able to bring that up, because by bringing up your complaint, you kind of mark yourself that you're one of them. And I do think that there needs to be mandated training. And I think there also needs to be penalties for people who fail against that, because we live in San Francisco and everybody just assumes that everything's great, but if you just go across the bridge, it's very different. I've had to link people to care in like Daly City and other places around that, it's a very different experience. But, when I first started, there was a G and an L, then there was a B, and then in the mid-90s, we added the T. And with every one of those letters comes a whole new set of complexities. Like, we are not one big monolithic community. We also age differently. I am so proud to have been a part of this study, because I've been a resident in California since my family left Guam in 1977. And I've never seen anything like this. I've participated in things like this internationally. And to think that California, which has San Francisco, LA, and these places which are so welcoming, is finally doing that, is just so moving to me to be a part of that. I wasn't expected to live to see 30. I found out I was HIV positive at the age of 28, but I'm still here. And I think that we need to learn from our past. It's like Harvey Milk said, you got to give them hope. I'm going to push that a little bit further. It's like, we got to have faith. We've done this once before. Hope means there's a possibility that it won't work out or won't go in our favor, but faith means we know that it will. And I'm hoping that we can learn from the past. I also think it's incredible to have an intergenerational workforce. Unfortunately, with HIV, there's a huge divide between my generation and previous generations. But I hope that my peers understand that this is the culmination of our work. You know, Queer, trans, non-binary, gender non-conforming folks, though that's the possibility. That is our hope for the future because if they can learn to be themselves, if they can be themselves now, then all of this in the future when they get to be my age won't matter because they would have had a lifetime of doing that. It's really hard for people to change behavior. And it's especially hard when there's not that environment that invites you to and welcomes that too. And so, we've got a lot of great examples of things that are happening, but we also have a lot of examples that aren't so great. And I'll just say this, and I want to make sure that Jupiter has time to speak. But whatever's happening right now, they can take books off of bookshelves, they can change curriculums. They can even silence us, but they can't take away our lived experience. And, one of the things going back to the HIV bit, when we were trying to push Senator Laird's bill back in 2021, we got pushback saying that HIV is just one thing that older people experience. Why should they be any different from anybody else? But no, there's a very different history. The other thing is that HIV and aging is often interspersed with LGBTQI plus aging, but it's a little bit different because mostly you're talking about cis men, the majority of cases in California, to be mindful that there are nuances, because straight cis women get HIV, and we want to make sure we don't repeat the same things that we repeated, where we left people behind. And that's my determination in the next chunk of my work. I plan to retire at some point, but I think there's a lot of work still to be done. As long as there's that work, I'll be there.
Well, Vince, I hope you never retire. That was great. Thank you. Thank you so much. Any questions?
I don't see any, Marcy.
Okie doke. All right. Thank you, Vince. So moving on to Jupiter. So let's see here, Jupiter. So we've heard from Kathleen and Angie about the important findings from the study. And Director DeMarois and Senator Laird stressed the importance of these types of findings in helping to shape the future policy. With that said, what do you think are effective methods to ensure the state and others receive adequate representation from the trans community on these types of surveys?
Thank you so much, Marcy, for that question. And also thank you to you all for having me. In regard to your question, I think intentionality and purpose are incredibly important. I think knowing your community and what your community is up against and what they need is absolutely crucial. When I was working to build the statewide coalition, one of the many conversation points that I had with stakeholders was the importance of having a common goal. And essentially, that was what many of our conversations were about, right? Because when we were asking folks to join this coalition, we were asking them to take time out of their busy schedules, to take time out of leading organizations and caring for their community members to be a part of this coalition. And one of the major points that really got them to want to participate, to want to be active and engage, is knowing that we had a common goal of where we needed to be. And much of what I did as well was contextualize what we were doing with the survey and the collection of data as to what was happening in the rest of the country, right? At the time when we first started the coalition, we were under the Biden administration, but we had seen efforts from years prior from conservative groups to dismantle and destroy as much data as possible. And that is what we are continuing to see today. So the preservation and the development of future data is actually it's something that we can all agree upon. So when we want the trans community to be involved or to have equitable and adequate representation in these surveys, it's important to know what the trans community is facing. It's important to acknowledge that the trans community is facing a different degree of discrimination with the anti-LGBT laws that we are witnessing across the country. I will also say for equity with the trans community, engaging and collaborating with trans-led and trans-centering organizations that have the knowledge, the feedback mechanism, and the community rapport to collect and gather information on how to best serve the diverse transgender community in California. Because that's the thing about California, is that we are an incredibly diverse state that even the transgender community within California has different immigration status, has different needs to healthcare, has different life experiences relating to family members. So that is also something to consider. For example, one of the things that really helped me in building the coalition was looking at what the Trans Latina Coalition did with an incredible survey of older trans Latinas in LA in a partnership with UCLA's Williams Institute, titled From Surviving to Thriving, a Quality of Life Study with Transgender, Gender Nonconforming, and Intersex Adults in the City of Los Angeles. And the outcome of that study was incredible because it also called um, for more access to employment and resources, such as for TGI folks to be able to update their identity on legal documents, more access to housing, and develop and fund TGI competent transitional housing, and along with having healthcare be more knowledgeable, and for healthcare to have the toolkit to support and embrace transgender and gender nonconforming individuals. I also believe that narrative discipline is incredibly important as we move forward in safeguarding and developing future data on the vulnerable populations within, the state's LGBT community. And what I mean by that is that we must understand transgender experiences as being foundational to the advocacy apparatus that we want to create when we uplift LGBTQIA seniors and the LGBTQIA community as a whole. Unless the most vulnerable are safe and protected, then we all get to enjoy those same benefits knowing that they are equitable for all. Additionally, transgender and gender expansive people of color have historically been at the forefront of social justice efforts for the LGBT community. For example, in 1967, Sir Lady Java, who was a Black transgender performer and activist, was prohibited by LAPD to perform as an impersonation of the opposite sex under Rule 9, which was an ordinance that outlawed impersonation performances of the opposite sex. The ACLU helped Sir Lady Java to challenge Rule 9, um, And the case was dismissed on a technicality, but it was a crucial step and will lead to overturning Rule 9 2 years later. Not only was the case pivotal in the fight for transgender rights, it also highlighted the need to challenge discrimination in employment, housing, and in medical care. All this to say, and I will be quiet now, is that we must and need to embrace trans stories and life experiences as our North Star when we advocate for better structures of care and access. When a trans person of color can access the programs and services they desire with ease, comfort, and safety, I can guarantee you that other community members of the LGBTQIA plus community can access those same services with as much ease, comfort, and care, if not more. So thank you.
Oh, thank you. That was so informative. Well, I wonder if that stirred up a lot of questions. Any questions out there?
I didn't see any questions yet, Marcy. There's some shout outs for Jupiter and also Vincent to keep everything going. Everyone appreciates their hard work. And there's some recommendations for Molly to look up different bills, but I don't see any questions.
Okay, great. Okay, then, do we have time for any more questions of the panel, Ross?
We have about 9 more minutes.
Oh, great. Oh, great. Okay. So, Jupiter, I want to ask you if you could give one piece of advice to a young trans person today. What would it be?
What I would say is to be yourself, to be bold, to never cave into fear. I think it's special to remind young trans people that they are special, that they are anointed by the universe to break the mold in their families, in their communities, in society. And the reason why I say this is because a recent report from from the largest trans survey ever, which was the 2022 U.S. Trans Survey, which was conducted by Advocates for Trans Equality, which received up to 84,000 respondents, reported that the top reason why trans people stop transitioning is because of transphobia, of feeling isolated, of facing discrimination, of being othered. And this is all something that we can see throughout the LGBT community, that when we when we cave into fear of who we are and we limit ourselves and we police ourselves, we then turn to isolation. Our mental health caves. And I think it's important to always give hope and faith to young trans people, to let them know that that there's a long lineage of not just older trans people, but of incredible older LGBT adults that have fought and sacrificed in order for us to be here. So that's what I would say to a young trans person, to always be bold and to always be yourself, because it does get better.
Well, that's really beautiful. That's great. Thank you. Thank you, Jupiter. I have a question for Molly. It's about how have facilities throughout the state implemented trauma-informed training, and what impacts have you noticed?
Yeah, so trauma-informed, so the Center for Medicare and Medicaid Services has required that all nursing homes providers have an understanding and demonstrate knowledge of trauma-informed care. There's not a certain number of trainings they have to provide staff. They just have to be able to demonstrate that they understand what trauma-informed care is. So I think this is another area for advocacy here in California. Trauma-informed care is sometimes incorporated into the annual residents' rights trainings that occur both in skilled nursing and assisted living and board and care facilities. And also there are requirements related to providing person-centered, person-driven individualized care. So that is at the core of what these facilities should be providing. For assisted livings, trauma-informed care is not mandated, but it's implied by, again, this notion that they have to be providing individualized care, and that's in residents' rights.
Thank you.
Yeah.
I wonder if I could ask both Vincent and Jupiter about the nonprofit world in terms of trauma training. It's been my experience that there's not enough of it that I've seen, but maybe you see that differently. And I mean trauma specific to the LGBT community, including trauma training for staff in LGBT nonprofits. So what's your experience of trauma training in nonprofit organizations, including LGBT organizations?
Well, I can start if I'm off mute. I find that these kinds of trainings are best done with someone who shares some of the lived experience of the people that they're training, because there's a common you need to find a common ground. Like a lot of times, a lot of research, a lot of training is done. There's a standard, that they compare that to, and I don't think that that standard has yet been written for our community because, so many things we don't relate to. Like for me, as a person living with HIV, the concept of normal has been like, whose normal are we talking about? Because it's often questioned because, I was told I wouldn't live to see 30. I'm 64 or, my age now. And the book hasn't been written yet. I haven't seen that yet where they kind of take that into consideration, so when we've done that and been successful, it's always been someone who was from the community, sharing the lived experience, but also being able to kind of look at whatever training was available and kind of bridge the two. Like for myself, I took a training on adult protective services and caregiving, and it's also very like in the aging service, I've seen it's very gendered, like in the binary piece, and like women are seen as caregivers, but me, who's taking care of all of my, like many friends, had many clients, I wasn't seen as a caregiver because I'm a cis male. And I think that going through those trainings and figuring out where does our community differ and how do we fix those nuances?
But Vince, there are trainings available from, say, Sage and Open House. I don't know if they provide trauma training for providers but they would, I would imagine, be able to speak to these issues.
That's what I mean, that having it, but the problem is that those aren't always well funded.
Mm-hmm.
And if you're out of the nonprofit realm, and like my parents are in a nursing facility that's for profit,
Yeah.
and they don't have money for these kinds of trainings. And so they give someone an article or a very simplistic video, and maybe look it up on YouTube or whatever, and then that's the training. I think there needs to be a little bit more stringency in how we decide. But like Sage and Open House, that's a perfect example. But can the people that need that training, can they afford that, or is it accessible to them?
Good questions. I don't know really. Jupiter?
Um, I will say that we are entering a time in which the capacity of nonprofit STEM of nonprofit staff is really being tested. And I know that trainings are accessible, but there's also that emotional piece that I think is very much missing, because when nonprofits are peer-led, in which they have members of the LGBT community caring for other members of the LGBT community, it's important to have the emotional and mental tools to
Mm.
understand that there are folks that have been through a great deal of trauma, and that trauma has nothing to do with caregivers and care providers, and sometimes that's very hard to differentiate because the work that we do is very personal. it is very intimate as well. And it's important to care for yourself and nurture yourself in what it means to be trauma informed in order to understand that other folks are working through their trauma, and that that looks very much different than what the industry standard tells us that we should do, or how we should act, or how we should respond. But I will say, from my experience at Open House has a very advanced way of not only caring for our community members, but also caring for ourselves as staff members, of leaning into each other, and having that culture of looking out for one another when it is that we feel sad, when it is that we feel emotional about certain experiences that we have with our community members. And I think that that is very much the model that we should be advocating for across all fields, whether LGBT or not.
Marcy, can I add one more thing?
Sure.
So what Jupiter just said is so right on. Our generation, my generation, we were just taught to just power through it. And sometimes those trainings like inflict trauma on the people attending them because we didn't know what to do with it afterwards. And what Jupiter said, and taking care of your staff, I think that is so important. But that's also a generational thing because I know with a lot of the young people that I've worked with, we have to know how to take care of ourselves. And so I think that's just was really beautifully stated by Jupiter.
Well, I think it was beautiful, but I do think the right kind of culturally appropriate training would actually help the staff tremendously, because I think they are dealing with a lot of trauma. And I think for the most part, I think they do a very good job. I know I've seen that in Open House because they do care. It's really who they are. But they're how to create a certain kind of empathy and compassion and patience and understanding with people who don't come from the same perspective. I just think that's important to figure out how to do and make it available to folks. Well, are there any questions about all of that?
I don't see any questions, Marcy, and I think we could transition to Susan. We only have a couple minutes left. Thank you so much to the panel.
Okay, is Alex going to talk?
So
Yes,
Susan
we're
will
going to
introduce Erin. Thank you.
I'm sorry,
Okay.
Eric. Yeah.
Good. Okay, I just want, before we move to our closing speaker, I just really want to thank Marcy, Molly, Vince, Jupiter, Bailey for staying with us also. Thank you. Thank you so much for sharing your perspectives and your experience. We're standing up an Aging and Disability Lived Experience Advisory Board, and just one thing we can point to with this survey is it grew our network. Jupiter, as you mentioned, through the coalition work, and the response that we had from the LGBTQ community to join the Lived Experience Advisory Board, we never would have had that response rate a year and a half, 2 years ago. It's because of the network that formed in response to this, to establish this survey. So thank you all for your remarks. And now the Master Plan for Aging is what we call a whole of government approach. And so we're going to close out with Erin Tax with SAGE. Erin, if you would conclude with some remarks from the federal perspective. You're an outstanding partner to California and every state in the nation as a leader. So we're just so grateful that you're here and can share your perspectives.
Thanks so much, Susan, and a huge thank you to CDA and all the advocates on the ground in California and all the amazing work that you're doing. At the federal level, I think many of you have acknowledged that the administration is doing everything and anything it can to roll back protections for an acknowledgement of the mere existence of LGBTQ plus older people and older people living with HIV. We see many LGBTQ plus targeted actions, including the proposed budget and the so-called Big Beautiful Bill that puts health coverage of 152,000 trans elders or trans adults generally who are enrolled in Medicaid at risk, eliminates transition-related health care for trans people of all ages, as an essential health benefit under the state marketplace plans. We see a slew of executive orders and other actions with intentionally demeaning language about trans people, including an anti-trans executive order that gendered binary infants at birth, an executive order to restrict access to gender-affirming care for people under age 19, an executive order banning accurate passports for trans and intersex people, of course, the anti-trans military executive order, an executive order restricting gender-affirming care for people in prisons. And I think all of these are really a foot in the door for people who are seen as lacking agency or somehow less worthy. But I think all these attacks show that the rights of all trans people are at risk, including trans older people. And if you think about this, when you're denying healthcare to people because they're simply in prison or they're young or this or that or other reason, when you're willing to deny people healthcare because of who they are, there's no logical endpoint, and the care of all of our healthcare is really at risk. We see other efforts to roll back fundamental protections for LGBTQ plus folks, including the interpretation of the Bostock ruling, which many of you know, enshrined protections with respect to employment based on sexual orientation and gender identity. And we saw the expansion of that under the Biden administration to include protections with respect to housing and access to credit. We see efforts to begin rolling that back at the federal level. We see the equal access rule at risk, which had protected people in HUD-funded segregated facilities from facing discrimination on the basis of sexual orientation and gender identity. We see that's no longer being enforced, and that will likely be rolled back. Meanwhile, the Older Americans Act reauthorization is in the balance, and we're afraid that the Older Americans Act regulations are also at risk. In a nutshell, our goal at SAGE is to ensure that all LGBTQ plus older people living with HIV are able to be themselves and still get the aging service and supports that they need to remain independent. We don't want them to have to put on an act to get the aging service and supports that they need. We want people simply to be able to be themselves. So we encourage everyone outside of DC to fight for our community. Of course, to follow the law, to follow the regulations, but to not engage in anticipatory obedience, and to continue doing important work that we're all doing, so all people continue to age in place with the services and supports that they need to remain independent. So thanks again to CDA for all that you're doing, and everyone in California for what you're doing for LGBTQ plus older people.
Thank you, Aaron. Right back at you. We appreciate your advocacy and your communications. You've just been doing an outstanding job keeping us well informed. And we're with you. We're with you. Thank you all today for joining us, for all of our participants, our two interpreters. Thank you, Angie, Kathleen, Marcy, Molly, Vince, Jupiter, Aaron, and of course to the CDA staff. Thank you especially for preparing for the webinar today, the links that we have on the screen and in the chat, and the follow-up that will be made available so that everyone who joined today can access the recording and share it with others. And if you didn't have a chance to ask a question or make a comment, please use our inbox, engage@aging.ca.gov. And thank you all, and have a good rest of the day and a good rest of the week.
Thank you, everyone. Happy Pride.